Thank you very much, everyone, for tuning in and joining us. A great audience here, and then also certainly the thousands that are listening online. Not to make my next guest nervous at all. This is your first time on air. Is that true, Sean?
That is correct.
So Sean Updegrove, AVP and CTO of Children's Hospital in LA. So welcome to the show.
Thank you. Good to be here.
Glad you could join us here. So when did you get in town for the conference?
I came in late Sunday night.
Excellent. Yeah. And is this your first HIMSS conference or no?
No, this is my second HIMSS conference.
Fantastic. How long have you been with Children's?
Just over 7 months.
Okay.
So fairly new.
Yeah, fantastic. So you don't realize this, but you are actually one of my most exciting guests because what you experience on a daily basis is what a lot of my listeners, mainly my listeners, are all C-suite executives in healthcare and hospitals and other provider organizations. So certainly want to dive in a little bit to what you're seeing in your community, because then that's the goal of this show over the next 3.5 hours today and then 3.5 hours tomorrow is to understand what health systems and practices are dealing with in their community today, and then what best practices can you share in all your wisdom to help them navigate the future of healthcare. So, starting off there, what are some of the trends that you're seeing in your community regarding healthcare and health IT?
Well, certainly a major trend is always security related, especially in the environment out there today. We've all heard those horror stories.
Well, you're
out
really
there.
close to it too.
Yeah, exactly. Too close.
Yes.
So security absolutely always is number one. At the same point, you can't let security rob our users of their experience. So there's a very fine line that has to be walked there.
Yep.
So that security doesn't become burdensome to the end user, to the partner using and providing care, but also to the IT organization having to operate within that structure.
So security is one trend. What other trends are you seeing in your community?
Oh, mobility, but that's been happening for a couple of years, but it's really starting to pick up. It's the closer you can get to the patient's side with the EMR and with the analytical data that's required for their care, the better. If you can sit right with a patient with the picture of their MRI, explain to them and their family what's going on, driving that closer to the patient is always one of the top things going on right now.
So mobility for your physicians and care providers and team members, or both to patients and consumers?
It's most strong on the provider side right now,
Okay.
but the trend also is going into the patient care side. If we can give them the opportunity to help manage their care via mobile app and by information pushed to that mobile app, so much the better, right? Because it's all about outcomes at that. So the closer you can get to the patient on that stuff, whether it's providing the care or follow-up on the care, the better.
So true. So what are some of the ways that you're addressing as an institution at Children's?
So a lot of it is certainly virtualization of the applications. One of my fondest sayings is the ability to deliver an app anywhere, anytime, to any user on any device in a secure manner. So there are a number of tools out there that do that. We use Citrix to do that, and it gives our providers an amazing amount of flexibility in where they get their data. If they get paged in the middle of the night, they can get on their own computer, log into the system, get into the EMR right there. It's that much faster time to response if there's an emergency or anything like that also.
Excellent. So that's one way. So how else are you addressing some of these trends with your institution?
We're always looking at the devices. A big trend and actually a problem is many of the EMRs aren't optimized for a mobile device, right? They're meant to be run by a keyboard and a mouse.
Right.
So whenever you put it onto something that's driven with your finger, it gets a little bit difficult there. So we're actually doing some in-house development to try to make a middleware piece for some of those, for some of the more immediate, often used workflows. Working with the EMR vendors at the same time, making sure they know of those types of requirements. I'm sure we're not the only ones that have those, but certainly working with them as partners to help bring a better application for a mobile type of workforce.
Yeah, actually, you bring up a very key point, and not that I come from the EHR industry. I love the EHR industry. I've been in it for 20 years, but there's still a lot of usability issues and concerns, and up to 60% of care providers today are open to discussing swapping out their electronic health records because of the usability issues and interoperability issues and so forth, and functionality. So, with that, I feel that as a burden in a way because I've been such a strong proponent of getting the right solutions out there. But also, it's creating a whole industry. There's a great company that I came across called Evoke, EVOQ, which actually they overlay and they provide a lot of access to the EHR data and offer clinicians and even patients access to information in a much simpler way. So people don't kind of have to throw out the baby with the bathwater, but can layer on. So, that offers a lot of opportunity. But I wish we had more functional. But on the opportunity side, if you create an EHR that's cloud-based and highly functional, highly usable, you're probably going to do okay. Even people say the EHR boom is over. No, it's not. There's so much opportunity, certainly in the outpatient side. But even I think that some of these players coming into the inpatient side are you've got some of the ambulatory vendors that are now moving over to the inpatient side to compete with some of that business. So. I guess, speaking from your post as CTO, what do you, when you look out over your community and your peers in the industry, what are 2 or 3 best practices that you might offer them and how to navigate all these changes?
Boy, that's a good question. It's a hard one because every institution is a little bit different. One of the things we try to do that's been very successful is really embed IT into the physician's workflow, right? Get out there, know what they're doing in a clinic meeting or a clinic encounter, right? What are they clicking on? What's the flow that best fits in with them?
That's excellent.
So that when we look at the future of IT, we have that sort of data to make sure we're designing to that as a specific use case. Oftentimes you hear about and you see physicians always saying, rightly so, that IT is doing things to them.
Right.
And we're very much trying to flip that equation.
What IT's doing for them?
Exactly, right. And when you get in there and on staff, we even have clinical professionals who are working for IT in this endeavor so that we can have that sort of a translation layer between an IT person and a doctor. Right, to come to what is a benefit of a workflow, and how do you optimize that workflow, right? It's as easy as eliminating logins here and there if possible. We're using tap-in, tap-out technologies in clinics, pre-launching applications in the background that they use a lot. Every bunches of those seconds that you save in a workday for a physician, that adds up pretty quickly to an additional patient that you can see. And just having data at your fingertips right away.
So no, that's fantastic. I like your approach there and kind of flipping that switch there. So was there another best practice that you might offer to people and tell them to kind of focus in on 2016?
I don't know if there's a single one. Again, I think every environment is going to be a little bit different. To me, I guess the best practice is you really have to partner with the physicians.
That's fantastic
advice. It can't
advice.
be the physicians versus IT.
Yeah.
And I've been in organizations where unfortunately it is that way, and you can't cooperate with the physicians and work with them in a bi-directional way, you're sort of doomed before you even begin to roll out anything. IT always tends to go for the shiny object.
Right.
This is cool technology. But you have to ask yourself, and you have to ask your partners, is this going to solve any problems for them or bring any benefits before you do it? Otherwise, you do get into that circle of you're doing things to me, and that's a bad spiral to get into.
No, that's fantastic advice because I believe organizations should partner with physicians and care providers because they're out there on the front lines as well, and they need to have technology and information that they can use. So I like your strategy. Well, Sean, pleasure to meet you today, and glad you could join the show, and hopefully we'll have you back.
Thank you very much. Appreciate it.
Take care. Thanks, man.